Hello, I'm Matthew Weinstock with Hospitals and Health Networks with a preview of our April issue. Every hospital executive knows that this is a time of upheaval, contributing writer Lola Butcher says in her cover story. Payer mixes are changing, inpatient utilization is declining, and providing value is becoming the new business mantra. Butcher's story profiles 4 hospital systems that are adapting their business models to not just survive, but to thrive as revenue models change. At Western Maryland Health System, for example, inpatient admissions have fallen by 32% in the past 4 years. But the system is better off because of it. In fiscal 2013, operating margins stood at 5%, and it's on track to hit 8% this year. The health system has moved entirely to a value-based payment model. 100% of its revenue is now fixed-based. As a result, the one hospital health system has shifted its priorities from the hospital and ED at the center to focusing on the full continuum of care. Pre-acute services, retail pharmacies, urgent care centers, and post-acute services are now driving the business model. The cover story illustrates how hospitals and health systems can adapt their operations even as the ground below them is continually shifting. Also this month, senior writer Paul Barr continues his series on the Boomer Challenge. In this article, he examines the impacts that boomers will have on Medicare's shaky financial picture.
Medicare is in financial trouble, and the nation's 75 million baby boomers may make the problem worse. They're aging quickly, and in a paradox, they're sicker than their parents were and also are likely to live longer. The situation isn't helped by the fact that many boomers lost a lot of money in the stock market and in real estate, and they haven't made it back. The boomers' poor financial health also could spell trouble for Medicaid, which pays for a lot of nursing home care. All this is a threat to both Medicare and Medicaid. Some health policy experts say there's hope in the new performance-linked models of care. Things like ACOs, medical homes, global payments may save the day. All of them are designed to give hospitals and doctors more incentive to improve care and reduce costs. If any of these approaches prove successful, then financial disaster can be avoided.
Our April issue also includes an interview with Sally Okun of Patients Like Me, an online social networking site that links patients with other patients who have similar conditions. Okun spent 25 years as a palliative care nurse, and as she'd sit in the patient's home having those very difficult kitchen conversations, she realized that patients and clinicians often speak a very different language. She says that providers are missing an opportunity to fully understand what's going on in the patient's life. For that story and more, be sure to check out the April issue of H&HN. I'm Matthew Weinstock. Thanks for tuning in.